It's very important to differentiate a couple of things: when to put an eye pad, when is the right time to patch the eye with a pad, and when it is the right time to patch the eye with a shield. And there are important techniques, very simple techniques to use when we apply a pad on the eye. The most common mistake is that if somebody has a eye injury, has a foreign body in the eye, has a abrasion, meaning a scratch, which creates lots of pain and watering, we would see patients sent to us or to casualty by just placing the patch on the eye like this and then taping it. This doesn't help. And the reason why is, if you look at the profile, you will see, blink for me, Rianda. Blink, blink, blink. You'll see the eyelid moves. And the point of pad is to stop the eyelid moving. And the easiest technique to apply is, if we know there is a problem in the eye that we need to put a pad on, we would apply drops if necessary. We would ask the patient to close the eye gently, so not squeezing, but just gentle closure like they're going to sleep. Close the eye. We'll pull the upper lid, the brow up and make the skin of the upper lid nice and straight, and then apply folded pad. If the patient is asked to blink now, he will not be able to blink because the pad is keeping the eye closed. And at that stage, apply Transpo Micropore sellotape on it. This is the proper pad. Now, if we are faced with a situation where it is not a corneal abrasion, but it is something like a corneal laceration, scleral laceration, or any serious penetrating injury to the eye, pad is not really very productive. And the reason for that is, pad is soft. You would like to protect the eye from the moment of injury to the patient arriving to operating theater where the eye needs to be repaired. You want to protect it, namely from infection, which usually kicks in later, and from mechanical pressure on the eye. So putting the iPad, folded iPad, on close the eye like this, it still does not prevent any mechanical pressure on the eye. Let's say a patient lies on the left side, applies pressure on the eye. If there is a laceration in the eye, the content of the eye can leak out, and that's what you want to prevent. So pad is not really 100% necessary in a case of corneal or scleral laceration. A see-through shield or any shield will protect the eye in this form by applying it there, putting strapping around like this, keeping, if possible, visual axis clear. Now, this serves the purpose of protecting from any mechanical pressure. So now, if there is a bump, if the patient lies down on the left side and presses on the eye itself, which is already open and soft, is not going to be under threat. And then there is a common scenario where a patient gets referred to us, they have a corneal ulcer or corneal infection of sort. And we would see patients being referred with a pad on the eye. That's not an ideal scenario to put a pad on the eye. In cases like infection, you actually want to leave the eye open until we see the patient and see what to do. Because somehow, by eye watering all the time, it reduces the bacterial load in that area and somehow reduces the intensity of infection.